Hi, everybody. Thank you for joining. Here is a very comprehensive discussion of Alzheimer's assessment. First, you start with the history, the medical history, any high blood pressure, diabetes, been in the hospital, stroke, any complications, cardiovascular complications, leg wounds, leg pain. Has the patient been in the hospital? What were the diagnoses in the hospital? Getting the old records are very, very important, especially CAT scans and hospitalizations. Has the patient had head trauma, weight loss, depression, or any Alzheimer's complications such as falling, more confusion, anger, inappropriate behavior, anything like that, you document it. And then we have several questionnaires that I recommend. The mini-mental exam, it's a 19 test that can assess whether the Alzheimer's is mild, medium, or severe. You need a questionnaire for inflammation that includes a history of arthritis, cardiovascular disease, chronic pain, diabetes, kidney disease. These are all diseases that are due to inflammation. If the patient has a lot of inflammation, the worse the Alzheimer's is going to be, the worse the cardiovascular disease will be. Do a depression screen. Depression is a very common cause of Alzheimer's, and it affects all aspects of the medical care. So that's very important. There's several depression screens available. Assess the body muscle. You can do with the weight machine. A nutritional assessment, the body mass index, blood albumin, and then the weight machine. I recommend a social interaction assessment because, again, this affects Alzheimer's. Persons who have very little social interaction are more likely to have Alzheimer's and more likely for the Alzheimer's to deteriorate quickly. Fall risk, balance assessment are very important. Falls are a very high common complicating factor in my practice. Assess activities of daily living, feeding, dressing, going to the bathroom. You need a New York Heart Classification score. That's a score related to congestive heart failure. Is the patient short of breath when walking, with sitting, with laying down? It's classification 1 through 4. Relationships assessment. Who do they best get along with? Who do they argue with? Focusing on the relationship is a good way to determine social and medical interventions. Exercise tolerance. Can the patient walk 4 or 5 feet, 20 feet, a block, use a cane, a walker? Happy activities list. That means what did they used to be happy with? Maybe a year ago, 5 years ago. With eating chocolate cake, spending time with the grandchildren, gardening, drawing, talking about travel. Find a happy list so that when the patient gets upset, angry, doesn't want to take medicines, you use the happy list to encourage them. Ask the family about all these things, because sometimes the patient says, "Oh, I never fall," but the family will say, "Oh, he fell yesterday," or "she fell yesterday." Are they taking their medicines regularly? And are they seeing a doctor regularly? And remember to get those old records. Okay, now about the physical exam. First start with the mental status. Do they know their name, where they are right now, their place, and the exact date, month, day, and year? It's very important. We'll do the neuro exam later on. How are their teeth? Bad teeth causes malnutrition, and infection of the gums causes heart disease. Listen to the lungs. Observe them. Are they short of breath when they talk? Heart exam. Do a balance test. I have them stand up, and I gently push on the sternum. I have my hand behind their back. I press on the sternum and see if they fall. Then I press a little bit harder on the sternum. Your hand is behind their back so they won't fall, and see if they fall. Then the last time I did it real hard, and prevent them from falling to see how bad their balance is. The neuro exam, you start with mental status, orientation, person, place, and date. And then you do cranial nerves, the eyes, or the eyes matching, facial expression, facial symmetry. The weakness was the arm, the right arm weaker than the left, leg one leg is weaker than the other. Reflexes in the knees, reflexes. Let me briefly talk about the neuro exam. Neuro exam is 5 parts. Is mental, cranial nerves, motor, sensory, and reflexes. First, mental, you ask about, do they know their name, do they know their location, home, clinic, and do they know the date, month, day, and year. So first, then cranial nerves, is the face paralyzed? It could be diabetic palsy, or it could be Bell's palsy, or it could be a stroke when the face is weak, plus the arm is weak, and the leg is weak. The next part of the exam is the motor, and you touch the string. Here, please push against my hand, push, and pull against you, and then you do the other arm, and then do the leg. But now I'm going to focus on balance because it's so important for falling. So I'm going to do a sternal push, a very light push. Okay, a very medium push. You warn the patient, medium, and now a real hard one. Most people, they will not fall, even the hard push. Keep your here so they don't knock down. Next, I observe how they're walking. Are they holding onto the furniture when they walk because they need the balance? Do they have a shuffling gait? They don't pick their feet up, just dragging their feet? Do they get up and before they get their balance, they start walking? All these are a high risk of them falling. And then last part of the neuro exam is sensory. Most important part is the feet. That's where the diabetes affects it and has problems with memory. The way I check the feet, okay, sir, I'm going to touch your toes. Tell me which toe I'm touching. And I cover it so that I touch the big toe and the small toe. Sir, which toe am I touching? And they should be able to tell which toe, the middle toe, the end toe. And if they have decreased sensation there, it could be diabetes problem, neuropathy problem, walking problem. Skin wounds, sometimes even redness can be a precursor to a skin ulcer. Fall risk, that's done by the balance test, a vision test, especially of diabetes and hypertension. Do they have bleeding in the eye that's decreasing the vision, that's decreasing Alzheimer's? Prevention of Alzheimer's and stabilizing it so it doesn't get worse is very important on vision and hearing. If the Alzheimer's patient has decreased visual input, Alzheimer's gets worse. Decreased hearing input, Alzheimer's gets worse. Alzheimer's patient needs to be stimulated in a good manner to maintain Alzheimer's or to improve it. Next, we go to blood tests. You do the routine blood tests, CBC, that's anemia and white blood count infection. CMP, comprehensive metabolic profile, glucose, EGFR is the kidneys, SGOT is the liver, albumin is for malnutrition. What other blood tests? Cholesterol, and test for inflammation, SED rate, and C-reactive protein. If these are positive, then it's much more likely Alzheimer's will get worse and hypertension, diabetes will get worse. You can do advanced cardiovascular profile, like checking for small LDL particles and LP parentheses A, or it's called lipoprotein small a. CAT scan for looking for strokes. And then one thing that I find that doctors ignore is chronic vascular changes. Sometimes the radiologist will say, no acute disease of the brain, but chronic vascular changes. To me, chronic vascular changes are very important. You know, there's a mild ischemia occurring in the brain, and one day it's going to be severe ischemia and cause a stroke. All these problems assess for serious cardiovascular disease. In the end, cardiovascular disease will kill the Alzheimer's patient. So that's the first thing you assess, and that helps determine prognosis and helps the family prepare for their loved one's death. The other signs that death is impending is not able to walk, don't recognize the family, not eating. Those are other signs that you can tell the family the end may be near. And then you look at complications of Alzheimer's, falling, worsening memory, agitation, not eating, refusing medicines, refusing to go to the doctor. These are all signs of Alzheimer's. And you can follow them over time. You can write it down. It's mild in 1 month, and then 3 months later it's medium, and 6 months later it's severe. So monitoring those symptoms and of Alzheimer's is very important to predict prognosis. Families always want to know, how much longer will my father, my mother, my husband live, and when can I expect to order a 24-hour caregiver? Maybe today all they need is 4 hours a day, but maybe in 3 months, 6 months, they'll need a 24/7 caregiver, or to assisted living, or to a skilled nursing facility. Also, it's very important to assess in Alzheimer's things that you can prevent, things that will decrease the progression of Alzheimer's. Depression is a very big one. I see that time and time again. If the patient's depressed, you can do the happy scale of activities, increase socialization. You can give medicines if the non-medicine treatments don't work. Another thing is lack of socialization, which can be related to depression. Depressed people tend not to call their friends, call their family, get involved. They hide in the room, they turn off the lights, they just isolate themselves. That's very bad for Alzheimer's and bad for depression. And it's a good socialization is a good treatment for happiness, better relationships, and a way to motivate the patient for healthy behaviors. For example, they refuse to take their medicine. Okay, Dad, let's call your best friend. Let's call your granddaughter, and after that, then we'll take your medicine. So using socialization as a motivation force can help all kinds of good health behaviors like eating, taking medicine, going to the doctor. And finally, malnutrition is very, very common in my practice. Many of my patients only eat carbs, crackers for breakfast, bread for lunch, and oatmeal for dinner. Alzheimer's patients need protein, fish, chicken, turkey, eggs, beans. If they have trouble chewing, eggs and beans are the best meals. If they don't want to eat a whole big cup, then 1 spoon, 10 times a day. But protein is very, very important. If they don't want to eat protein, then you can do ice cream or applesauce and add protein powder, that powder that the athletes take to increase their muscles. Your physician can give you malnutrition suggestions for your patient. So in summary, when you're evaluating a Alzheimer's patient, first you look for cardiovascular disease, because that's most likely to cause death. For prognosis to the family, look for Alzheimer's complications, because that determines how much the family has to get caregivers and how often they see the doctor, and look for ways to prevent these complications, such as if they have falls, use a walker, such as nausea and not eating, try to decrease medications. Next, you go to the physical exam, looking for side effects of cardiovascular disease like stroke or heart attack, looking for complications of Alzheimer's like poor balance, not oriented to person, place, and date. Look for skin wounds. That's a sign of inflammation and can cause pain and suffering. They need a vision test, retina test. Then blood tests, looking for dehydration, kidney failure, diabetes, cholesterol, inflammation, and a CAT scan, looking for acute or chronic stroke, and also looking for chronic vascular changes. All right, I enjoyed talking with you today. Please email me if you have any questions. Remember, love is more important than penicillin. See you next time. Bye-bye.